So hello everyone. Today we will discuss healthcare cost escalation in Malaysia. First, what is the medical inflation? Medical inflation refers to the continuous increase in healthcare costs, and this cost include the hospital fee, doctor consultation, medical treatment, and health insurance premiums. So who is affected? The first is household. Households are the group most directly affected by rising healthcare costs. Families need to spend more money on medical treatment and insurance, and this creates the finance pressure, especially for low and middle income households. They may have less money for food, education, and savings, and some families may even delay or avoid medical treatment because of the high cost. The second one is the government also will affected because it provides subsidy healthcare through public hospital and clinics. As the population and healthcare demand increase, the government needs to spend more on hospital, medical equipment, and healthcare workers. And this increases the pressure of the national budget, which can reduce funding for other important sectors such as education and infrastructure. The third one is insurance company because they need to pay higher medical claims when healthcare costs increase, and this creates a greater financial rise for insurers. To cover this cost, insurance company may increase the premiums. So as a result, some people may reduce their insurance coverage or stop buying the insurance, which leave them less protected during the medical emergency.
Next, I will present the key data trends of Malaysia's demographic shift and healthcare economy changes. To start with population aging trends, Malaysia officially became an aging nation in 2021, with citizens ages 65 and above existing 7% of the total population. This upward trend is ongoing. The elderly proportion rose to 8% in 2025 and is projected to reach 14 to 15% by 2015, while the national median age has increased to 31.3 years. Two main factors drive this trend is falling fertility rates and improved healthcare that extends life expectancy. Although this shows social progress, it creates higher long-term medical demand and pressure on the national healthcare system. Next, moving to medical inflation, Malaysia faces continuous healthcare cost growth. Importantly, medical inflation greatly outpaced general inflation. General inflation stays stable at 1 to 3% yearly, yet the private sector medical inflation ranged from 8% to 12% annually. Four key causes lead to this issue is rising elderly healthcare demand, advanced expensive medical technology, higher operational and staff wages, and increasing insurance claims that push up household premium costs. Overall, medical inflation is a long-term structural challenge, not a temporary problem. The next slide explains the direct link between population aging and rising healthcare costs. Elderly groups are more prone to chronic illnesses such as diabetes, hypertension, and cardiovascular diseases, which require continuous treatment and long-term care. This creates a growing healthcare demand that exceeds system capacity, triggering consistent price increases and forming a continuous medical inflation cycle. Economically, this combined demand pull inflation from higher service usage and cost push inflation from rising medical operation costs. Next, I will explain the macroeconomic impacts of aging population and medical inflation. First, it increases government fiscal pressure due to rising public healthcare spending. Second, it burdens household finances, especially for low and middle income groups, reducing disposable income and limiting domestic consumption. The third one is the shrinking working age population raise the dependency ratio, slowing labor productivity and economic output growth. Lastly, persistent medical inflation lifts the overall national price level and affects public living standards.
Moving on to the economic model, the medical inflation as a supply side shocks. Initially, the economic is at equilibrium point A, where aggregate demand intersects with the short-run aggregate supply curve SRAS1, resulting in price level P1 and output level Y1. However, rising healthcare costs such as treatment expenses, specialist fee, pharmaceuticals, and imported medical equipment have increased production costs in the healthcare. As a result, the SRAS curve shifts leftward from SRAS1 to SRAS2, creating a new equilibrium at point B, as shown in the graph. The price level increased from P1 to P2, while output decreased from Y1 to Y2. These situations reflect stagflation, where inflation rises while output falls. It also helps explain why healthcare services are becoming more expensive and less accessible to some groups of society. Proceed to market failure in healthcare. The above graph illustrates market failure caused by information asymmetry, where healthcare providers possess more medical knowledge than patients. Initially, the market is at equilibrium with price P1 and quantity Q1. However, providers may recommend additional treatments, tests, or procedures that do not always necessary. This increases healthcare consumption and shifts the demand curve from D1 to D2. As shown in the graph, the new equilibrium results in a higher price P2 and a higher quantity of service Q2. This leads to overconsumption of healthcare service and creates a dead weight loss, which represents a loss of economic efficiency.
This presentation focuses on four main healthcare policy frameworks in Malaysia, namely the Public Healthcare Subsidy Policy, the Health White Paper Reform Policy, the Private Healthcare Regulatory Framework, and the Medical and Health Insurance or TAKAFU regulation, which is also known by MHIT. Firstly, Malaysia practices a heavily subsidized public healthcare system where patients only need to pay between RM1 to RM5 for basic healthcare services in public clinics and hospitals. This system is mainly funded through taxation, and under budget 2026, 46.5 billion ringgit Malaysia was allocated to the Ministry of Health. One major strength of this policy is affordability. Malaysians from different income groups are able to access healthcare services at a very low cost. Besides that, this policy promotes healthcare equity and improves healthcare accessibility for the public. However, there are several limitations. The system creates a heavy fiscal burden on the government because a large amount of public funds is required every year. Public healthcare facilities also face understaffing as well as insufficient and outdated equipment. In addition, overcrowding and long waiting times have become major issues, especially as the aging population increases healthcare demand. So to strengthen this policy, several improvements can be implemented. One important step is upgrading healthcare infrastructures and improving technology integration in public hospitals and clinics. This can improve efficiency and reduce congestion. Malaysia should also reform its healthcare financing system through shared responsibility mechanisms, such as medical saving schemes or salary-based contributions. Another recommendation is to expand preventive healthcare programs to encourage early treatment and management of chronic diseases. These recommendations can reduce reliance on expensive private healthcare services while improving long-term healthcare sustainability. Next is the Health White Paper or HWP. This is a long-term healthcare reform plan supported by World Health Organization or WHO. The policy focuses on strengthening primary healthcare, preventive healthcare, digitalization, and healthcare financing reform. One strength of the HWP is that it improves healthcare sustainability and strengthens primary healthcare services. Besides that, it encourages preventive healthcare practices among Malaysians. However, the policy still has several weaknesses. For example, there are no clear measurable targets or financing mechanisms. In addition, implementation of the Health White Paper may increase operational costs, while workforce shortages may affect the success of the reform process. The government should establish clear milestones and measurable targets to monitor policy progress more effectively. At the same time, stronger workforce planning is necessary to ensure there are enough healthcare workers to support the reforms. Better financing mechanisms should also be introduced to support long-term implementation. In addition, implementation strategies must be improved to ensure that digitalization and healthcare restructuring can achieve their intended objective. The third policy framework is the Private Healthcare Regulatory Framework. So private healthcare services in Malaysia are regulated under the Private Healthcare Facilities and Services Act 1998. This framework mainly focuses on licensing, requirements, and quality standards. One advantage of this policy is that it helps ensure healthcare service quality and patient safety. In addition, private hospitals are able to provide more specialized healthcare services with shorter waiting time. However, several limitations contribute to medical inflation. One major issue is the lack of an effective price control mechanism in the private healthcare sector. Besides that, the profit-driven pricing system increases healthcare costs for patients. Lastly, the two-tier healthcare systems create inequality between public and private healthcare. To improve this framework, the government should strengthen price regulation in the private healthcare sector. Malaysia can introduce a centralized fee schedule system similar to Japan's healthcare model to standardize treatment and consultation charges. Price transparency should also be improved so patients can clearly understand healthcare costs. Besides that, the Ministry of Health should strengthen monitoring system to reduce overcharging practices. These measures can help control medical inflation and improve affordability for patients. The final policy framework is Medical and Health Insurance or TAKAFU regulation. This sector is regulated by Bank Negara Malaysia, and the RESET initiative was introduced to maintain affordable insurance coverage. RESET stands for Revamped Medical and Health Insurance or TAKAFU regulation. The initiative aims to enhance price transparency, strengthen the digital health system, expand cost-effective healthcare options, and transform provider payment mechanisms. One strength of this framework is that it regulates the insurance industry and improves healthcare's financing access. It also supports long-term financial protection for Malaysians. However, several challenges still remain. For example, insurance premiums increased by around 40% to 70% in the late 2024. Besides that, insurance regulation alone is insufficient to control rising healthcare costs. As a result, insurance has become less affordable for elderly and middle-income groups as the insurance policies is getting more expensive. To strengthen this framework, Malaysia can introduce a national high-risk pooling system inspired by Germany. Under this approach, insurance companies contribute to a shared risk pool to reduce pressure from high medical claims. Coordination between insurers and hospitals should also be improved through pricing agreements for treatments and services. In addition, transparency in claims data and treatment costs should be strengthened. These recommendations can help stabilize insurance premiums and improve healthcare affordability and accessibility.
There are 4 expected outcomes, which is lower medical inflation, better household financial protection, more efficient healthcare resource allocation, and last but not least, a sustainable healthcare system. Firstly, these policies are expected to lower medical inflation. Strengthening public healthcare and improving private price regulation can reduce the excessive pricing and also help maintain more stable healthcare costs over time. Secondly, the policies can provide a better household financial protection. Household financing reforms and insurance improvement can lower out-of-pocket expenses, make insurance premium more affordable, and reduce financial burden, especially for elderly and B40 households. Thirdly, these policies can improve healthcare resource allocation by reduce the supplier-induced demand and unnecessary treatment, while also focusing more on preventive care. Healthcare wastage can be reduced and the resource can be used efficiently. And finally, these reforms can strengthen the long-term sustainability of Malaysia's healthcare system. With a better healthcare capacity for the aging population, improve access and service quality, and control long-term healthcare spending can also support a stronger economic sustainability in the future. To conclude, medical inflation and the aging population have created the healthcare pressure in Malaysia, as healthcare demand and the treatment costs continue to rise to this day. Although Malaysia has implemented many policies such as subsidized public healthcare and insurance regulation, this report found that the existing policies still face limitations in controlling long-term healthcare cost escalation, especially within the private healthcare sector. Therefore, the proposed policy reforms, including stronger healthcare financing, preventive care, insurance improvement, and a better price regulation, can also help improve affordability, efficiency, and the long-term sustainability. Overall, sustainable healthcare is not only important for public health, but also essential for Malaysia's economic stability and social well-being in the future. So that's all from our presentation, and thank you for listening.